Some people rock and some people roll. Some will make you giggle right down to your soul. She'll talk to the world and introduce them to you. And look at me now, I'm all Barbara and you. You gotta take a step inside the shoes of another. Get to know your neighbor, get to know one another. She'll talk to the world and introduce them to you. And look at me now, I'm on Barbara and you.
Good evening and welcome to our program. This is Barbara Foster and I'm glad you could join us tonight. As I introduce you to this lovely lady sitting beside me, Lauren DeLuca. And Lauren is the founder, I have to read this to make sure I get it right, of the Chronic Illness Advocacy and Awareness Group.
Yes.
Okay. But I guess from the name I should know what that means, but can you expand on it a little bit?
Yes, actually, last year I found out through a procedure that I had suffered from a chronic illness, and for a few years we were trying to figure out what was wrong with me. And I had seen through really the social media that a lot of changes were happening in the chronic illness community, that they weren't getting the proper treatments. So what I wanted to, we have organizations for raising awareness for all sorts of diseases. And those wonderful work, but what we didn't have was something to raise awareness of what we are kind of referring to as the other opioid crisis. And the organizations were not really aggressively attacking this issue. So I wanted to raise awareness that all chronic illnesses are being greatly affected by legislation that's being designed to combat the opioid crisis and the street drug abuse. And really, as separate groups, we're not getting heard. So, and nobody was touching this subject because it is controversial, but there are millions of Americans that truly need opiate medication, and to take it away from them is a form of torture because you're subjecting them to extreme harm. And I wanted to raise awareness to that because it was a great injustice that was happening to the chronically ill across this nation.
Well, you're a bright young woman, and it takes courage to start something. And so you saw a problem, and you said, I want to see what I can do about this. At the same time, you're not totally 100% healthy.
No, honestly, I was reaching out because I didn't understand why I was not getting the appropriate care when I was in an emergency situation. And a lot of doctors were citing the opioid crisis as a reason not to help, as they were citing DEA fear and things of that nature. So I decided to go in, naturally, once I was diagnosed with my illnesses, I went into the support groups. And I saw in the support groups, everybody they were talking about being removed against their will from their safe medication regimes they've been in for decades. And newly diagnosed patients were being denied access altogether, like myself. And unfortunately, it seems that we've lost sight on the fact that opiate medication is life-saving medication if it's used as prescribed.
Okay, I get it now. I think I get it now that there was this conflict. But it also kind of reminded me of the Americans with Disability Act that goes back, 20 years or more.
Yeah.
But that was also, it sounds like something that started like that did with a group of people who felt we're disabled, we need ramps, we need elevators in all the buildings, we need handicapped bathrooms, all this. And so you never know what one little seed of a thought can do.
Yeah, and honestly, last year when I decided to found the group, I was spinning my wheels for 6 months as an individual who needed help, and I came to a grim realization: it wasn't going to happen unless I found more people, and I knew that they were everywhere from the support groups. And honestly, I was specifically lied to by medical facilities in the state of Massachusetts multiple times about my rights and about the law. And I thought about the people who didn't have, let me digress a little bit. I have industry experience as I'm a commercial insurance agent who happens to specialize in life science and pharmaceuticals.
Oh.
So by nature, I just knew the law and I knew I was being lied to. But I thought about all the people who don't know the law and who will accept that as truth and who would go home and think that they had no help, no hope, that their life was nothing but pain and suffering, I could not go to bed and feel good about that.
That's a very good point, and of course there's quite a few years between my age and yours, but when I grew up, you just took what doctors told you and that was it. You didn't ask questions, you didn't delve into things. Yeah. They knew best. But that times have changed over the years.
Yeah.
Now, this may sound like a foolish question, but I don't like to assume things. Is there a basic definition, without specifics, but is there a basic definition of what constitutes a chronic illness?
Well, a chronic illness is anything that just isn't going to be cured, anything that's going to last over 3 months. So there are our Vice President, Jane Flanders, who could not be here today. She actually suffers from 8 illnesses, endometriosis, Ehlers-Danlos syndrome. She's actually recently been diagnosed with lupus. That's actually, unfortunately, why she couldn't join us today. And I apologize.
Your train of thought.
I lost my train of
chronic illness.
thought.
She has 8 different ones.
Yes,
chronic illnesses.
and there's so many of them that are managed in different facets. And what a lot of people, and myself even, failed to, I guess I could call myself blissfully ignorant until I got into a true emergency situation. I had no idea how difficult life is for the individuals with chronic illnesses and the obstacles that is in their way to get the treatment, to be able to help their entire body and be able to improve their quality of life and to be able to participate in some sort of quality of life. As a lot of the media is focused on the opioid crisis, but they're failing to clarify that this has actually turned into a street drug crisis, that the opioid prescriptions in a lot of the pill mills have been reined in from the legislative changes that we brought in, like the prescription drug monitoring programs and things of that nature. They have really reined in the abuse, the abuse that was happening within the system. But now it's almost as though we've gone too far, that we're now just continuing to take it away, even though the problem itself has been resolved. And unfortunately, in my conversations, I've been contacted by terminal illness patients, patients who are in hospice, patients with cancer, who are being told by their doctors that their cancer isn't painful enough. So we're even talking about cancer patients now. And this started in 2016, and I had no idea.
Well, and you're still fairly young, having started just so recently, because I mentioned the ADA goes back more than 20 years, I think. And another, well, first of all, back to the definition of chronic. So basically, you have an illness that is not going to be cured, and the situation is you need to learn how to cope with it and live as best you can.
Yeah, and to manage the various symptoms, because each illness will have its own array of symptoms.
Right.
And like I myself, I would not use just opiates. I have an array of medications to help manage my illness. So it's a piece of a puzzle. And when you take that puzzle piece out, it collapses.
Right. And you know what, another difficulty that I would imagine you come up against is you look very healthy.
Yes. Yes.
And it's the same thing with people with a handicap who might need a placard to park their car, but they get out of the car and they look fine.
Yep.
Well, the people observing them have no idea how much pain they're in.
Exactly. That actually happened to Jane recently. She had a pedestrian literally just yelling at her, and just because of the placard. And the judgment upon individuals with chronic illnesses, especially in the current legislation, with all the changes and the focus on the opioid crisis, it has created a hostile medical environment for individuals with chronic illnesses. Their doctors are questioning them, and it's all stemming from legislation changes, as the doctors are now, unfortunately, their license and their livelihood is being threatened by, unfortunately, the DEA.
Yeah, and we will say hello to Jane, and we're sorry you couldn't be with us tonight. I know she's watching.
Yes.
And we maybe a future date you can come back on, but she obviously is very important.
Yes,
to help
she's
you
crucial.
Keep things moving.
Yes, her and I we are partners in everything.
Now, let me ask you what may be a naive question, but the opioid crisis, many of the people who've become addicts it's because they were put on something medically and then they became addicted to it.
And that is also what I believed. And until I got really into this work, I thought that that was the case as well. Unfortunately, the studies do not show that that's actually a fact. That is rhetoric, and that is something that's been spouted on TV often. But it is not backed with any clinical research that states that. And there are a lot of individuals, and actually we have individuals within our chronic illness community that are recovered addicts, that are being denied treatment because they're recovered addicts. However, they're still a human being in great suffering. And to deny someone who has a aggressive disease that they cannot control their organs, their body, and especially someone who is recovered from drug abuse, to deny that person any type of compassion or care for their disease, it's nothing short of torture. So we are actually standing for both communities, and that these are both communities that have a lot of similarities in that we both need help, but in very glaringly different ways.
And that's a very good point, that there's similarities, but there's differences too, and it's not that you're trying to take something away from somebody else who needs it. You're just wanting people to be more realistic. Am I stating that correctly?
Well, actually, almost what we've got going on in the country is, I think what's happening is they are sacrificing one community for the other, because there's been so much pressure to fix the opioid crisis that the sole focus has been on how can we fix this, and it's been very tunnel visioned into the prescriptions because that's where it started. And when we're looking at 20-year data studies, we're seeing the prescriptions have gone down tremendously. And when you actually look at the death certificates and the data that's been produced, it's actually polypharma, which is a term I've recently been introducing with others, is that it's a combination of substances where an individual who takes an opiate, then goes drinking, then does cocaine, then they die. But they get logged as an opioid death. So the public hears opioid, but it was actually cocaine, heroin, alcohol that killed the person, not a prescription. So it's a misleading statement that's it's very easy to mislead with a change of term, opioid, heroin. So a lot of our legislators, and the media included, are misleading by just using improper terming. They're not lying, but it is not being forthright with the public. So it's unfortunately fueling this because the public is continuing to demand change. And the legislators keep pushing for it. And at this point now we have people with serious diseases turning to the street. And now they're overdosing because they're getting something that they didn't want to get. They're just trying to treat their disease that their doctor's now refusing to treat. And we have interesting, back in March, actually, and it's been said for a very long time within the chronic illness community, the Centers for Disease Control was actually kind of where this stemmed from in 2016. And they had admitted in March that they had inflated these numbers, that we are actually, the deaths that are published in the media often say 66,000. Well, then that's actually street drugs. 66,000. When you break it down, we have 22,000 that the CDC had been stating is our overdose death. But when we dived in deeper, that jumped down even lower because a chunk of that was heroin. And then a chunk of that is polypharma. The actual amount of people who are overdosing from just prescriptions is minute. It's less than 1% of the American population. And we are, as our organization, we're looking at the whole picture, that we need to combat street drug abuse, but taking medicine from the sickest of the sick is the last way to do it. Now where actually Massachusetts is being investigated for engaging in torture of its citizens because of the denial. We have 5 states being investigated by the Human Rights Watch in New York for Maine, Montana, North Carolina, Massachusetts, and the 5th state's going to kill me, but I can't remember.
And to back up a little bit, you said before you founded this organization, you went to a lot of support groups. And support groups have been known to be very beneficial because if whatever you're suffering from, only someone who's been there can really understand and have the empathy for you.
Yes.
Are there still support groups for people who are chronically ill?
Yes, there's still a lot of support groups, and everybody, really the support groups at this point have become support groups for people who are being removed from medication. I would say 90% of the conversations in there are people saying, help me. And I've actually, every legislator I've met with, I have personally invited into my private group on Facebook to please look at the people screaming for help. The reason our organization was raised is I turned to my own illness fund for help, and I got crickets. So I decided to stop letting this happen to the American public, and maybe I can succeed, maybe I can't, but every mind I can turn, every person I can make aware that this is happening, we can stop this, because we have 10,000 baby boomers retiring a day. And we're going to need surgeries. We're going to need people to be taken care of. And that's going to be a big expense. But there's no excuse for the richest country in the world to allow such suffering to happen. And we have, the federal government is fully apprised of what the real situation is, as I attended the Georgia Opioid Summit to hear what actually was going on with the legislators. And I was the only person there that probably stood for giving opiates to people who truly medically necessarily needed it because they had a serious illness or disease. And the information being presented was, some of it was just nothing short of a lie. And it was shocking.
And it's very brave of you to take that on. And
A little scary, I'm not going to lie. It is a little
and
scary.
we're talking just about 2 years ago that you started the chronic illness
Actually,
advocacy and awareness group.
6 months.
Oh, well, you said in when you said 16.
I apologize. 2016 is when the Centers for Disease Control issued what's called the CDC guidelines. Oh, okay. And what those were they were guidelines trying to give a best practices for opioid prescribing and give limits as to what they think is the appropriate amount. Unfortunately, it wasn't done with full transparency to the public. It also didn't have pain management specialists. It didn't have the physicians with training in diseases. Actually, it was very heavy with special interest groups, and the key individuals actually leading it were physicians for responsible opioid prescribing, which actually pushes to remove opioids from patients, and they are very tied into the addiction community. And the board has very strong ties towards the addiction community, and this is easily a profit for individuals in that area. And I'd hate to be that.
You wouldn't sleep at night.
Yeah.
That's what I'm hearing.
Yeah.
Is you wouldn't sleep at night. So it's only been 6 months since you formed the group. And how's it been received?
Incredible, actually. At first, it was tough. It was tough getting people to accept this. It was tough to get people to tell the truth. But, after I went to Georgia and filmed 20 hours of footage, people are honest with me now. And we're getting some headway, amazing headway. We actually just returned from Washington, where we met with legislators for a few days. And we're in discussions with a variety of congressmen and senators and congresswomen discussing a federal bill, because there is actually a way that we can fix this for not only chronic illness patients, but for substance use patients as well, that can not only bring balance back into our healthcare, that we could potentially advance medicine in this country decades by just restructuring some things. And I'm very excited about the discussions happening with our legislators, and I'm hopeful that I could come back in a few months and we could talk about the name of a bill and go into it a little bit more.
Well, you have an invitation to come back. Call me early, because we can book early. Now, you're producing a show called World of Pain?
Yes.
Tell me about that.
World of Pain is actually, again, Jane and myself's brainchild, in that as we were working through this is really everything that has happened. It's just really, we've been thinking on our feet, as it gets very interesting when you are fighting literally really for your life, you think fast, you get creative. So we decided, as we were reaching out to the community, we're always asking, what can we do to help you, and to help you to call the right people, to fight back. A lot of people are very scared. So we're doing a lot of calls to action, telling people to call their legislators, but still we're finding a lot of people don't quite understand what's happening to them because it is very complex. And it's convoluted with state laws, the FDA, the CDC, you name it, they're involved. So because I have the industry background, I can understand the very complex laws and the way they're writing because they were read as about user-friendly as an insurance policy. So we decided that we were going to launch this program to discuss all things chronic pain and the things that were happening in the law, so that when we do a call to action, people understand why they're calling and what that law means to them. And the people who think that this isn't their fight will realize this is their fight. Because just because you do not need help now, you're going to one day. And you're not going to want to be in the emergency room screaming help and not understanding why you're not getting it.
But everybody isn't going to have your tenacity or your energy
Yes.
or the background that you have or be as articulate as you. So and then bearing in mind at the same time they're fighting a chronic illness.
Yeah.
So would you say how many people have kind of joined your group?
Actually, what we did is we formed coalitions with all the with nonprofits and for-profits working in the healthcare field. We actually signed in the pancreatitis organization recently, as that was one of the illnesses that I suffer from. And I was really glad when they came to the table. And we're actually working with all the organizations and building, really, it's almost a standing petition to the government. When you have nonprofits standing against you and chaining arms together, we have a serious, serious problem with going on in the legislature. And we, luckily, actually, I woke up this morning. At first, I was reaching out to them, saying, come to the table, let's join up. And we actually launched and went global about a month ago, where we joined in an organization in France. We've joined another organization in Spain. We have members across the world, all the way in Thailand, Canada, because America, we have always boasted being one of the most humanitarian countries. So when we make a bad move, the world is following us. And right now the world is following us in a dark, dark path. So the world of pain is really for the truth, because it's not being publicized, and this is affecting every American, and even if they don't know it, there's a tagline being told to every individual in this country. Opiates, there is no study that prove opiates work for long-term chronic pain. Well, interestingly enough, there are also no studies over 12 weeks. Chronic pain is over 12 weeks. So that's what I'm saying when it's misleading the public, because if you're not going to do a study over 12 weeks, well, of course there's no studies that prove it. You don't do it. But you're leaving off that part when you tell the public. So I'm going to be going, not myself personally, but our whole group and myself, we will be working as a team. And through social media, we are connecting, and we've gone global. And with the organizations, we represent over 200 million chronic illness patients in this world.
Oh my goodness.
In less than 6 months.
That is, I was going to say, what are you most proud of that you've accomplished? You've accomplished quite a lot. How can people get more information? Do you want to give a website or your Facebook page?
Absolutely. Our website is Chronic Illness, we have a few.
Okay.
Our Facebook is Chronic Illness Advocacy and Awareness Group. And our show, World of Pain, will be running through there, so that each week we'll be telling people what's happening in the country, why you should care about it, and what you can do, who to call, and how to fix it, and how to go through the necessary channels. And we have our website, which is just ciaag.net. And
Say that again, please.
it's ciaag.net.
Okay, that's going to be easy for people.
Yes, that's the acronym for Chronic Illness
Right.
Advocacy and Awareness. And there we have all our coalitions, which we're signing on more every day. I woke up this morning, we had contact from a few pain management specialists. I launched the show Monday, and we've already gotten a couple physicians that want to work with the organization. And we've gotten interested from 2 new coalitions that want to sign in because they agree this needs to stop.
Nothing really gets accomplished without funds to support it.
Yes.
How in the world are you funding this?
Credit cards, which is a pretty...
Your credit cards?
Yeah, we're substantially in debt, but honestly, I made a leap of faith. I made a true leap of faith, and I said, you know, what is my life, what is money worth if I'm not here? So I took up my credit cards. I almost paid them off, and luckily they were almost paid off. And I've been using them to run the business, to get me to the locations and our team. But we are now reaching out for our angel donor because I am unfortunately disabled, so my income is now gone, and I'm fighting on spirit at this point. And but luckily, I feel that leap of faith is going to be worth it.
Well, as I mentioned at the beginning of the show, the coincidence that my next guest puts on fundraisers for medical situations and other difficulties, which we'll find more out about in a very few minutes. If someone listening wants more information, they can find it on either of those sites you mentioned. And what if they wanted to make a donation?
We actually can take donations right on our website. We have a donation tab. And I can always be contacted at info@ciaag.net directly if anybody wants to join our coalitions to help to donate, or to simply reach out and to join us as a member to stay up to date with what's going on and learn how you can fight back, because you can fight back and you can win.
What is the biggest misunderstanding of what people don't get it, what you're trying to do and why?
I think the biggest misunderstanding is that people don't know that this opioid crisis is being misframed. And it's being misframed intentionally. And it's because the media is not telling the truth. Just tell the truth.
Gee, there's a surprise.
Yeah.
So that's why. To editorialize.
So on World of Pain, I'll be telling the truth every week.
Right. And is there something you want our viewers to know that maybe I haven't given you a chance to say yet?
I think really just be open-minded, because I was personally completely ignorant of this myself. And a chronic illness patient, just having a chronic illness can change your life so dramatically. So if somebody says it hurts, it hurts. So if maybe our doctors need to have a little more compassion and understand that their patients know what they're talking about. We live in our body, and if we say it hurts, listen.
And there is the bureaucracy that it goes beyond the doctor as well, with the insurances and like you said, what the media is portraying.
Yes, and unfortunately, the doctors are being directly threatened by legislation, stating that if you do not comply, we will take your license. If a doctor prescribes a medication and the patient goes and does something they're not supposed to, the doctor may face criminal charges up to murder. And of course they're not going to prescribe, excuse me. I mean, you could face murder charges on a patient. Nobody would risk that. I wouldn't risk that, and I have a chronic illness. So why are we threatening our doctors with jail time? When a person has a diagnosed, aggressive, and known chronic illness, there's no reason not to exempt them. And the law right now states that we are protected. But the CDC guidelines were written to try to create prescription caps, which when I was in Georgia, I attended an excellent presentation from a physician, an addiction specialist, Stefan Cortez, who studies this and works with the Veterans Association. And it was, as I strongly suspected, but finally confirmed with clinical research, that the findings were opioids were that individuals on under 90 milligrams morphine equivalent, which is being recommended by the CDC guidelines, they actually found the majority of overdoses and suicides were in that range. And this is veering off into my own personal opinion now.
And I'm almost out of time.
The spike in suicides is greatly due to the forced reduction of medication. My illness, I honestly, I cannot get out of bed. It takes me 2 hours to move.
And
that's
I
with
so
medicine.
appreciate you being here tonight. And obviously, I noticed, and I don't know if the viewers noticed, but there were times that this was very difficult and it was very emotional for you.
Yeah.
So I really appreciate you sharing with us.
Thank you.
Do come back with Jane and update us as
Yes,
things
I'd
move
love to.
along. And keep up the good work. And I'll put you on my prayer list for your
Yes.
illness.
Thank you, Barbara. Thank you so much.
Thank you, Lauren.